If you're a mature gentleman engaging in self-pleasure, there's something crucial I need to discuss with you. Have you ever wondered if this practice remains truly beneficial after reaching 50 or 60? Perhaps you've harbored private concerns about potentially causing invisible harm to your body. If these thoughts resonate with you, you're definitely not isolated in this worry. This topic remains shrouded in confusion, outdated beliefs, and a clear shortage of reliable, transparent information. This concern ranks among the most prevalent yet rarely discussed anxieties for men in their golden years, and after reviewing available data, the widespread uncertainty becomes completely understandable. Studies reveal that while the majority of men past 60 continue engaging in self-stimulation, many do so in darkness, unsure about real consequences on their hormones, prostate health, or even their performance with partners. This is precisely why we're having this honest, research-based conversation today. I'll walk you through 10 astonishing benefits of mature self-pleasure, followed by 10 critical risks you must understand to ensure your habits remain healthy. Let's start with the encouraging news. The first benefit involves maintaining penile health. Achieving erections increases blood flow to the penis's spongy tissues, known as corpora cavernosa. Think of this as physical therapy for your reproductive organs. This regular exercise preserves tissue elasticity, which proves essential for achieving and sustaining firm erections throughout aging. The second advantage supports prostate health, which represents a major benefit. Multiple large-scale studies, including a landmark Harvard University research project, have linked higher ejaculation frequency with significantly lower prostate cancer risk. The theory suggests regular ejaculation helps eliminate potentially harmful substances and secretions from prostate ducts. Third, it strengthens pelvic floor muscles. The rhythmic contractions during orgasm engage key pelvic floor muscles, particularly the pubococcygeus muscle. Strong pelvic floors are vital for erectile function, ejaculatory control, and preventing urinary incontinence, a common aging concern. Fourth, it reduces cortisol, the stress hormone. In our high-pressure world, this represents an incredible built-in advantage. Research demonstrates that orgasm causes significant cortisol level drops. Lower cortisol helps regulate blood pressure and reduce anxiety, making it a natural tool for cardiovascular and mental well-being. The fifth benefit involves releasing beneficial neurochemicals. Orgasm floods the brain with dopamine, our motivation and pleasure molecule, plus oxytocin, often called the bonding hormone. This natural mood booster provides well-being and emotional connection, proving invaluable for mental health. Sixth, it aids physical problem detection. Self-pleasure makes you intimately familiar with your anatomy. This regular self-examination represents one of the most effective ways men discover early signs of conditions like testicular cancer, penile fibrosis, or other abnormalities that might otherwise go unnoticed. The seventh advantage improves sleep quality. After orgasm, hormone releases like oxytocin and prolactin, combined with cortisol reduction, create powerful sedative effects. This helps your body relax deeply, making restorative sleep easier to achieve, something often challenging with age. 8. It enhances overall pelvic circulation. Beyond just penile benefits, self-stimulation improves blood flow throughout the entire pelvic region. This benefits bladder health, prostate function, and surrounding muscles, preventing issues from stagnation and poor circulation. The ninth benefit serves as ejaculatory control training. For men struggling with premature ejaculation, self-stimulation provides safe, private space to practice techniques like the stop-start method. This allows better understanding of your body's signals and builds greater control, translating to partnered intimacy. Finally, the 10th benefit keeps sexual desire and neural pathways active. Your brain is your largest sex organ. By regularly engaging in sexual fantasy and physical stimulation, you maintain neural circuits associated with desire and arousal. This preserves healthy libido and sexual responsiveness, even without regular partners. But for a complete picture, we can't focus solely on positives. Healthy practice requires conscious awareness, so now let's discuss 10 potential risks or negative effects requiring your attention. The first risk is social isolation. This becomes problematic when self-pleasure stops being part of healthy sexual life and becomes a substitute for genuine human connection. The solution requires awareness, ensuring this practice complements, rather than replaces your social life. Second comes the risk of skin microlesions. This typically happens with overly aggressive stimulation or inadequate lubrication. These tiny tears cause irritation, inflammation, and can become infection gateways. The fix is simple: always be gentle and use quality water-based lubricant. Third is desensitization risk. If you stimulate yourself identically with the same pressure and rhythm every time, your brain becomes conditioned to only that specific touch. This makes achieving arousal or orgasm with partners difficult. The solution involves varying your technique, rhythm, and focus areas. Fourth, it can mask erectile dysfunction's underlying causes. If you achieve erections only during self-stimulation but not with partners, you might ignore the issue. However, this can hide serious health problems like heart disease, diabetes, or hormonal imbalances. Noticing this pattern requires doctor consultation. The fifth risk involves nerve compression from poor posture. Many men engage in self-stimulation while sitting in hard chairs or hunched over, potentially compressing the pudendal nerve over time. This can cause genital numbness or pelvic pain. The ideal approach involves comfortable, relaxed positions like lying down with proper support. Sixth, it can become an unhealthy emotional escape mechanism. Using self-stimulation as your only stress, boredom, or frustration management tool creates behavioral dependency. Having diverse emotional management tools is essential, including exercise, meditation, and social communication. The seventh risk involves guilt and shame feelings. Many men grew up with strong cultural or religious self-pleasure taboos. If these feelings persist and cause distress, speaking with sex-positive therapists or counselors can help reframe this natural practice more healthily. Eighth comes pelvic congestion risk. While infrequent ejaculation poses prostate risks, excessively frequent ejaculation, multiple daily sessions over long periods, can sometimes cause heaviness or aching in testicles and pelvic areas. The solution is moderation and listening to your body's signals. Ninth involves potential semen quality impact. This only concerns men actively trying to conceive with partners. While it doesn't harm long-term fertility, daily ejaculation can temporarily reduce sperm concentration. For optimal quality, studies suggest 2 to 5 day abstinence periods work best. The 10th risk is reality disconnection, often linked to pornography. If self-stimulation becomes heavily dependent on extreme or unrealistic pornography, it can skew expectations and make connecting with real-life partners difficult. The solution involves balancing visual aids with imagination and memories of authentic experiences. As you can see, self-stimulation after 60 isn't simply good or bad, it's a tool, and like any tool, usage determines effects. The secret ingredient remains consciousness. Practiced with awareness, body respect, and moderation, it becomes a powerful ally for health and vitality. I hope this conversation proved helpful. I genuinely want to know your thoughts. What was today's most surprising point for you? Leave a comment below and let's continue this important discussion together. If you found value in this content, please give it a like and subscribe for more straightforward, well-researched mature health advice. Don't forget hitting that notification bell so you won't miss our next conversation. Stay healthy, and I'll see you in the next video.